Hello. I've had some questions on self-management of your asthma and how best to combine this with information and prescriptions from your own doctor. The problem is really related to asthma flare-ups and how to manage these to prevent an asthma attack requiring hospital admission. I became more aware of the issues when I recently saw some comments from people on an online asthma platform in the United Kingdom, where people could share problems related to their own asthma. 4 of the common questions that I'm going to deal with today and talk about in this episode are: should I have an asthma management plan? Should I have a course of steroid tablets to use if I have an asthma attack? How do I know when to take these steroid tablets? And finally, how do I know when to stop the steroid tablets? So what are my thoughts about these 4 questions? So starting with asthma self-management plans, should you have one? Now the answer from my perspective is definitely yes. Yes, because asthma is a chronic, ongoing disease that can and does flare up sometimes without much warning. And when that happens, you need to have the knowledge to recognize the asthma flare-up, and you need to know what to do when it happens. So that's what an asthma self-management plan does for you. There's lots of very good evidence that if you've been provided with a self-management plan, that you've agreed with your own doctor, that you're less likely to need hospital treatment for your asthma. That is, of course, if you follow these recommendations and advice contained in your asthma self-management plan. So this plan will include 3 bits of information. And these are: first, the plan will include information on your asthma inhalers, which one is for regular use to keep your asthma well controlled, and which one is for relief to treat your asthma symptoms. Next, your plan will also include details explaining how to tell when your asthma is flaring up or going out of control. And the third thing your plan will do is it'll give you guidance on what to do if your asthma is flaring up. And this guidance will include what treatment to take and when to call for help if it's not helping. On the treatment, the plan will tell you which inhaler you should use for a flare-up, which are also called exacerbations. However, I personally prefer to use the terms either flare-ups or asthma attacks. So the advice you get on which inhaler to take when you have a flare-up will depend on what inhaler medication is available in your country and what your doctor has prescribed for you. I have discussed the different asthma inhaler drugs in a few previous episodes, and I suggest you listen to those if you haven't already. However, for now, I'll summarize this information for you. In an asthma flare-up or an attack, 2 things happen. First, your air passages get tight or they go into spasm. And second, there's irritation of the lungs. And this irritation is called inflammation. And the inflammation causes the air passages to swell up and also to get filled up with mucus or phlegm, which also cause, in addition to the tightening of the air passages, they also cause blockage of the air passages, so the oxygen that you're breathing in can't get through very easily. So the treatment of an attack will include 3 drugs: a reliever, a controller, and possibly oxygen, depending on how bad the flare-up is. Now the reliever works to reduce the tightening or spasm of the air passages, which results in them opening up. And this might be a short-acting reliever inhaler. That's the blue one that you'd be advised to use, preferably with a spacer device. Or if the attack is bad enough, you may be treated with a nebulizer to deliver this reliever. And this is usually done in a doctor's rooms or in a hospital, for the main reason that a nebulizer should ideally be used together with oxygen. Alternatively, you may have been prescribed an inhaler which combines a reliever and an anti-inflammatory controller. This combination inhaler is called an anti-inflammatory reliever, and this is used for both control of your asthma and for relief. your doctor will have told you what kind of inhaler you've been prescribed. Now, you may also be prescribed a short course of steroid tablets, which I'm going to talk about in a moment. So your plan will give you information on how to tell how bad the flare-up is, which inhaler to use, and when to worry and call for help. Now, what most plans will say is that if your flare-up is not being improved by the action you've taken, that you should then call for medical help. If the inhalers you've been advised to take by your doctor are helping to control the flare-up or the attack, then your plan would advise you what to do next. Ideally, to consult your doctor to see if this flare-up could have been avoided. Okay, so the second question is whether you should be prescribed a short course of steroid tablets to take if your asthma does flare up. And these steroid tablets are also called corticosteroids or oral steroid tablets. In my view, the answer to this question is also yes. Now, if you think about this, if you're having a bad flare-up or an asthma attack, and your inhalers are not controlling the flare-up, then the treatment, according to the asthma guidelines that doctors use, should include steroid tablets. Or in severe cases where you're too ill to swallow, these drugs would be given by injection. Now, in my view, here are the reasons why you should have these drugs available yourself. These steroid tablets take at least 6 hours to start working, and they work by reducing the inflammation and swelling of the air passages, and therefore they should be started as soon as possible. So what do you do if you have an attack in the night or the weekend or on holiday when you're away from your home? Now, I don't know what things are like in other countries, but in the United Kingdom, it can be very difficult to get to see a doctor, a general practitioner anyway, in the evenings or the weekends. In addition, it can take up to a few weeks to get an appointment to see your own doctor. So rather than having to go to the emergency department, it's logical that you should have some of these tablets to start taking according to your self-management plan, if these are needed for the flare-up of that particular attack. So your asthma treatment does depend on you following your doctor's advice. However, your doctor also has a role to play. And in this case, in my view, you should be provided with a self-management plan that you've agreed with your doctor to follow. And in the view of most experts worldwide, this should also include when to start oral steroid tablets, and therefore you should be provided with a prescription to either collect in advance or to collect from your pharmacist when you need it for an acute asthma flare-up or attack. Now, most self-management plans will include an instruction on when and how to start corticosteroid tablets when your asthma goes out of control. This advice will depend on past experience of your own asthma attacks and your doctor's own knowledge of your asthma. However, the self-management plan most commonly used in the United Kingdom does not include details on use of oral corticosteroids by people with asthma. And this might explain why a number of doctors in the United Kingdom have stopped giving their patients a prescription for the steroid tablets to keep at home and to use when these are needed in emergencies. It's difficult to understand why these plans in the UK do not include the use of steroid tablets, and frankly, for me, it's very puzzling, because the UK guidelines, these are the signed BTS guidelines, clearly state that steroid tablets should be used for asthma attacks and that they should be started as soon as possible. So I don't know what's happening in other countries, and would really be interested if you could email me at theasthmaspotlight@gmail.com with this information. So there are two problems related to asthma self-management plans. If your plan does not include details on when to use oral steroids for asthma flare-ups, you would need to see a doctor urgently if your asthma is not responding to your usual treatment. Now, from my experience in the United Kingdom, it's very difficult to get to see your own doctor at night on the weekend. And at the present time, it can take up to 2 weeks to see your primary care doctor. So your only alternative would be to go to an emergency department for treatment. Now, while this is sometimes necessary and your only option, in my view, if you have your own supply and been clearly instructed how to use these steroid tablets, that could prevent the need for you having to go to hospital. If your plan says that you should start the steroid tablets if you're having a flare-up or an attack, in my view, it's logical that you should be prescribed with that prescription to use in accordance with the plan. Having explained this, and to be very clear, the treatment of asthma is aimed at preventing asthma attacks. However, if you're having an attack and can't get to see your doctor urgently, in my view, you should have a course of these tablets available so you can start taking them early. In addition, if you have needed to take 2 courses of steroid tablets in a year, it's a good idea to be seen by an asthma expert to find out what the problem is and to see if you need different treatment. This is current advice in the United Kingdom, and I assume it would be advisable in other countries as well. The final 2 questions I'm going to talk about today are: when should you start taking the steroid tablets, and when should you stop? Now, as I've said in previous podcasts, everyone is different, and everyone's asthma will be different from other people's. So the answer to both of these questions depends on your asthma, your past experience of your asthma, your own ability to understand and to self-manage your asthma, and most importantly, what your doctor has advised you to do in your self-management plan. And your doctor will base their advice on their knowledge of you and your asthma. Having said this, your doctor will base any advice for you on the published evidence and guidance documents which are published in your country, as well as internationally. In general, and as I said, you do need to base your self-management on your own doctor's advice. However, in general, asthma guidelines would typically recommend 3 times when you should start taking steroid tablets for an asthma flare-up or an attack. So these 3 occasions are: if you get worse quickly, or if your peak flow drops below 60% of your best level, you should start taking cortisone tablets. Second, if your short-acting reliever inhaler, now that's usually the blue one, does not last for 4 hours. In other words, if you need to take another dose less than 4 hours after the last dose, you should start taking your steroid tablets. And the other common bit of advice is that if you've had sudden severe asthma attacks in the past, you should start taking your steroid tablets early. Now, in addition to these 3 situations, your doctor may advise you to take the tablets for other reasons. So, for example, some self-management plans will advise you to take extra doses of your usual medication. So, if you don't improve after taking more of your usual reliever and inhaled corticosteroid after a few days, you'd be advised to start oral corticosteroids. Now, if you have needed to start taking these steroid tablets, you should really contact your doctor urgently to make an appointment to be seen, so that your doctor can decide whether you need more treatment, and also how long you should continue taking the steroid tablet. And this leads us nicely into the final question for today's podcast. And this last question is: how long do you continue taking the steroids? Now, the answer to this question is not the same for everyone or for every asthma attack. And the main problem here is that it's very difficult, if not impossible, to tell how long an asthma attack is going to last. This is a question that I often ask when I'm lecturing to doctors and to nurses who are dealing with asthma, and no one can come up with an answer. So we don't know how long an asthma attack's going to last. The United Kingdom asthma guidelines, for example, state that 3 days of steroid tablets are usually enough for children, and 5 days are usually enough for adults. However, and very importantly, these UK guidelines also say that you should continue with the tablets until the attack is over. Now, that's the reason why it's so important to see your doctor or trained asthma nurse soon after you were treated for the attack. And in my view, this should be before you run out of the steroid tablets. So the reason for this is that if the attack has not cleared up, you may need more steroid tablets. So, how do you tell if the attack is over or not? There are 3 main clues that will help you to know the attack is over. First, if your peak flow has returned back to your best level and is not changing or fluctuating by more than 20% from morning to evening or from day to day. Now that assumes that you're taking your peak flow, and I would strongly suggest that when you're trying to decide whether you're recovering from an attack, that you measure your lung function using a peak flow meter. The next way to tell if your attack is over and if you need to continue with the oral steroid tablets is if you are still needing to use your blue reliever inhaler for symptoms. And if you are still needing to use the blue reliever inhaler, then the attack is not yet over. And the other clue that you might need to continue your steroid tablets is if you are still waking up from your sleep due to asthma symptoms. And those symptoms, to remind you, are coughing, wheezing, or trouble with breathing. Asthma symptoms are often worse at night, and so if you're waking up due to your asthma, that means that your asthma is out of control. And if this is just after you've started oral corticosteroids for an attack, it means that the attack is not yet over. So in summary, in my view, based on my own experience and the current research evidence and current asthma guidelines, you should have a personal acute asthma self-management plan that you've agreed with your doctor. Your plan should include instructions to take a short course of steroid tablets if you're having an asthma attack that's not improving when you followed your plan provided by your doctor. Next, you should ensure that you see your doctor or trained asthma nurse soon after starting a course of steroid tablets. That's to find out whether you need more steroid tablets, or if the attack is over, it's also to find out why you had the attack and to help you to take the necessary action to prevent a further attack. And finally, how can you tell that your asthma attack has cleared up? The 2 important clues that an attack is over are first, that your peak flow has returned to your normal values, that's your personal best values, and second, that you no longer need to use your short-acting reliever, which is usually the blue one. If you found this podcast useful, please share it with friends and colleagues. And if you have any questions, please do write to me at asthmaspotlight@gmail.com.